I don't know if it's just me, but I just have some apps on my mobile phone that I can't delete. Do you have those apps on your phone? Yes. Why can't you delete it? Why are they forcing you to keep it? Okay, just open this book. I just noticed that the organizing team asked us to download the mobile app, okay? And number 2 says what? Install and open the app. Now, someone probably called the typewriter back and said, hey, guy, I think I want you to add something. Won't take up space. Why are they begging you to keep the app? Because you won't download it. Because online platforms are failing. Because there are so many solutions out there that you can't keep all of them. And that is why at RemindMe, our job and what we've done is to bring offline solution for African problem. And that problem is the problem of immunization. And the only way to reach mothers that are in rural areas and low-income areas is to provide a software, a sophisticated software that works without the internet, without a smartphone, without access to 4G network or even the 5G network that Samsung is coming up with. So that brings me to a lady called Amina and her son Saliu. In her hand, she has a paper that they use for recording the child's immunization schedule. Now, this paper could get missing. There could be errors because we have a lot of literacy issue in Africa, so there could be errors on this paper. Now, you know what that causes? Repeated vaccination. So Saliu gets immunized for polio 2 times. So what happens? There's an overdose, and Saliu misses one of the immunization he's supposed to take, and Saliu has a problem in the future. Amina expects Saliu to be standing here in the future, but Saliu would die. What is the obvious impact of using a paper to record all of this? There is an 8.2 immunization completion rate. That is, people that start the immunization and end it, just 8.2. Let's go further. Why do we have 8.2? Why is it so low? The card collection rate is 29%. That is the people that even have the card that Amina is holding, just 29%. So due to errors and all of that, we have an 8.2 completion rate. I just hope you're following the journey, right? Are you all following the journey? Okay, so what if we could take all of this to the cloud? And that is what we've done. We've completed our proof of concept, and we're working with the Nigerian government to scale it up across 3 states for an official pilot. And then from there, we're looking at taking it across Africa. So let me run you through our solution. First, you can register childbirth with our solution. The UNICEF in Nigeria recently cried out that we have a less than 12% childbirth registration in Nigeria. What does that obviously cause? Poor decision making. The development agencies cannot do much because they don't have access to data. With our solution, you can check immunization history of the child so you don't repeat. And all of this is done using a code, a USSD code that works offline. Now, let me give you a little picture. You know when you dial your *55 something hash on your mobile phone, I know you don't do all of that in America, but in the low and income developing countries, that is how we live. They can also check for nearest healthcare center. So to find the nearest healthcare center, they just check it up and locate the nearest one to reduce the cost of vaccination services. Essentially, we are increasing demand for vaccination services and also empowering the system. So caregivers or relatives receive automated voice calls and SMS. Let me just talk a bit on this. We started with providing SMS reminders, but we now notice that they can't read English, so we moved to local languages. But trust me, we discovered that, because I was in the field, we discovered that the SMS wasn't working because people who do not go to school cannot read their local language. So we had to introduce local voice calls, automated local voice calls, to strengthen the system. We also provide USSD inventory management for hospitals so they can communicate to the development agencies and the government their inventory level. We also help them manage appointment booking and push notification for emergency. Imagine that there is an outbreak in Africa and it's for children that are 3 years old. How do they get that data? Just from us, because they will just go to our platform, pull the data of children that are 3 years old, and send their caregivers a text message to come and immunize that child. So we are providing an emergency system for them. So this is what we have. The code is *347*01. You can access our platform for immunization, maternal care, and for hospital management. And basically, we are supporting the caregivers to increase demand for vaccination services. We are supporting the healthcare workers to confirm that an immunization has taken place, because we allow them confirm using the child's unique identifier. We also support development agencies by providing them access to our data for them to take decisions and prepare their reports. So our scale-up plan is to keep it free for the next 24 months, and we are into the 6th month now. $1 for 5-year subscription, and then grants and license fees for dashboard access. So guys, let's work together. I'm still around DC for some time. You can communicate to them, and they will get to me, or you give me your card. I'll reach out to you with the header, let's work together in your country, or you can work with us from where you are. Thank you so much, and I'm glad to be here. Yeah, thank you.
What do you know about why people don't complete their immunization, that 8%? Is it just because they're not getting reminded, or are there other things going on?
So,
how are you addressing them?
Essentially, is one, they don't know the importance of the immunization. And apart from sending them reminders, we also communicate to them the importance of doing the immunization itself in their local language as well. And they also, the problem of the paper itself, when there are errors on the paper, they can't track it. When the paper goes missing, these are common issues that lead to them not completing the immunization, amongst other factors. Yeah.
I really appreciated your iterative approach and your learning approach so far. As you enter this pilot, the 3-state pilot, what are you hoping to learn from that, and how would that change your product going forward?
So every day we keep learning, and each time we talk to agencies, the federal government, the state government, the development partners, each time we speak to them, there is a new feature that we get to add. So we are much more open to learn. We have an open mind to learn. And at this time, our focus is on reducing the burden of healthcare workers, which is why we have 4 major networks in Nigeria. Every day we keep working to add a new network. So right now it's working on 3 networks, and is remaining 1 network, and that network even has the lowest number of subscribers, but we are still working to get them on board. So the aim is to reduce the burden on health workers by providing more access to the technology, which is getting more networks on board. Yeah.
Is there any form of a growth hack that you can do here? I've definitely seen in the US and Europe players that have gone direct to, the doctor community might be a bit looser here, but to go get the electronic health records and ingest them, is there any kind of fast forward so you can be banging out a lot of SMSs quickly?
Okay, so for the electronic health record, we have, because we have data of the child's due dates, so now the health worker or the mother is supposed to impute the child's unique identification that we give the child to confirm that the immunization has taken place. So with the same code, which works offline, they can access the child's immunization history to see the journey where the child is on any immunization. So we're providing the same technology offline. They don't have to go somewhere else to get that.
Partnership with the local government is probably exceptionally important.
Yes.
What is the main challenge you are facing when you are communicating with the local government to really get full support from them?
So I am a strong believer of going back to your roots. So when we did our proof of concept, I went back to my state in Nigeria, where I had some local influence, and we were able to get them to get on board. This is a welcome development in Africa, so it's not really difficult to get them on board. Where you have to do more work is where they are fighting with the project, and with the support of their partners that are on the table, which you're aware of, they are always willing to jump on it since they are not the ones spending the money. Yeah. Yeah.
Can you give me a little bit more on the financial model in terms of how you got to the price subscription?
Okay. So what we currently are. It's free for the next 18 months. We are into our 6th month now. After that, we are going to take $1 for a 5-year period, to keep it sustainable. That is to say, they are going to pay 20 cents per year, okay? And that would cover the cost of providing the reminders and keeping the service on board with an extra 20 cents for a markup on it. So that, and as well, we're going to receive grants and awards and non-equity investment and donations to keep it going. But the reason why we are charging the $1 for a 5-year period is to keep it sustainable, even if the funders say we're not funding anymore. And I have another point to that. We would be charging some license fees for the development agencies who need to access the platform for data reasons, and also providing consultancy services for people who want to use the same technology to affect other areas of the system. Because agriculture will need this solution, but financial inclusion will need this solution. So anybody who wants to use our software codes or to use our knowledge about the system to build, already we've done something for M&E with some foundations, where they're using the same offline technology to collect data on the field offline. So we are willing to provide consultancy services for anybody who needs the same technology to collect, to do another project.
What is your experience working with big pharmaceutical companies? And can this system also make sure that they are getting the right vaccine?
So I come from a product development background. So I have the ability to blend into scenarios once I am very well informed about the situation. So I have little or zero knowledge of the pharmaceutical system, but I'm really certain that this solution can help in combating the problems that they face in their sector, as long as it's going to be used in the low-income developing countries.
How do you understand at the community level some of the trust and privacy concerns?
So to start with, if you go to our platform, our website, you're not going to see a sign-up button there for development agencies. You can only see a login button. That is because we profile the people who can have access to the data ourselves, based on the instruction of the federal government or the state government. So they can only log in but cannot sign up to see the data. We take privacy to be very, very important. And because the solution works offline, it is almost impossible for someone to check someone else's data without knowing the person's unique ID, which is only revealed to the caregiver via the mobile phone. It is important to also know that in Nigeria, we have 180 million people, but we have 144 million registered phone numbers. So that means that the solution is here at the right time.
All right, we are out of time. All right, so while the judges wrap up their notes, can you tell us a little bit about how you practice staying becoming a successful entrepreneur, becoming a successful change maker? What do you practice in order to do that better?
So personally, I feel there is a global action to take action. There's a global call to take action. And what that means is that we had 1,300 applications, and 500 came from Nigeria. So what that means is that young people in Africa are taking action, and I'm so excited I'm part of them, and I'm the one solving this problem, because someone else would be solving it if I'm not. So for me, I believe that this is an opportunity to take action and nothing else.
I have two questions around inspiration. I'm going to start with a different one than I did with another group. Who inspires you or motivates you?
I think
along this journey.
My community.
Pardon?
My community. So the people around me, my family, the support I get, and the fact that organizations like yours have put me on a stage like this, it's probably enough to keep me for the next 3 months.
Can you share with the audience how you go about learning?
So research is key, and also having an open mind. Don't lock yourself up somewhere. Open your mind to a whole lot of conversations. I think the only conversation I've not opened my mind up to is the blockchain conversation, but I'm excited, the young people that came on stage, they spoke so much about it, and we'll speak more to see how we can learn about that technology. But beyond that, have an open mind and learn as much as you can learn.
That's great. And the last thing that everybody's ready, but one more thing. What's something, a piece of advice you would share with the audience in terms of launching their own ideas? So
don't let anyone stop you. The no means next opportunity. You're going to. Anybody who doesn't support you doesn't understand it. it doesn't mean it's irrelevant, you know. So just keep pushing it, you know. Once you are sure, back your project with data. Understand the model, understand the environment, understand your audience. If you are certain it's going to work, then keep doing it. Keep pushing it. We started with one network, you know, and we went to speak to another network, and they didn't buy into it. But after they saw a particular state do a big event, you know, to launch our program, they called us themselves, you know. So if you keep doing it, people are around watching to see how long you hold up, and they will put in their support. Yeah.
Awesome. Let's give them a big round of applause. Thank you. Great job.